Oh, good times. We love technology here. Everyone, thanks so much for being here. 211 staff, we are so grateful for all the work you do in the community. My name is Jody. I'm the Learning and Development Specialist here at SSF, and it is my role to support you, our provider community, by creating trainings and info sessions to help you resolve homelessness. So, if this is your first time being with us with SSF, thank you again. Today we are joined with Ricardo Reyes from DHA, Department of Human Assistance, and he's going to speak briefly about the Housing Disability Advocacy Program.
Yay!
Where's the confetti? And then we will be joined by Leah Kingsley, who will talk about how SSF fits into this and the referral process. And we are recording this, yay. And if you so choose, we can send you a copy of the slides as well. With that, we can begin. I'll probably move through just a few intro slides about SSF and our core services. Everything that we do at SSF, of course, is to resolve homelessness through leadership, convening partners. That's you, that's us. We're convening with data-driven best practices and, of course, building capacity through system performance. Our core services have really helped us kind of refine how we show up in the community. And we've really identified increasing capacity and knowledge is how to refine our data best practices, right? So anytime we develop a training, it's really to help expand your capacity and your ability to serve the community. Our presentation today, I mentioned earlier, is really about the overview of DHA, some eligibility. Ricardo will go into understanding program services and components. And as I said, we'll wrap up with Leah. And Ricardo, I'm going to turn it over to you. Thank you again for being here. I appreciate it.
Morning. Well, first and foremost, good morning, everyone, and happy Wednesday. I'm super excited to be here to talk a little bit about HDAP. For those that may not know, HDAP stands for the Housing and Disability Advocacy Program, but that was not always the case, and I just want to put that disclaimer out there. In 2024, the program, formerly known as the Disability Benefits Advocacy Program, was officially renamed the Housing Disability Advocacy Program, also known as HDAP, at the request of CDSS. And I believe earlier last week, that is now reflective in HMIS. So you should see that HDAP program listed in HMIS. I'm the supervisor for the outreach and the HDAP programs here with Sacramento County Department of Human Assistance. And I have a very small but mighty team of 2 social workers, Lavana and Danya, who kind of run this program. Next slide, please. A little bit about HDAP. HDAP is designed to assist individuals who are experiencing homelessness, chronic homelessness, as stated by the HUD definition, and who are also unemployable due to a disability that is expected to last 12 months or longer or result in death. And that's very important because HDAP will provide case management services, housing navigation, medical care coordination, and benefits advocacy to assist in the applications or appeals of disability benefits. And that's our key component of the program is our social workers will assist HDAP customers with applying for SSI or SSDI programs. The case management provided will include homeless systems navigations and referrals for other homeless services and programs. Next slide, please. A little bit about the eligibility. Participants must be identified as highly vulnerable by a CAS assessor, be at least 18 years of age or older, be experiencing chronic homelessness, have a mental health or physical disability that is expected to last 12 months or the individual is age 65 or older. They must not have an approved SSI or SSDI application and not have an authorized representative or attorney assisting them with the SSI and SSDI application process. And the reasoning for that is because once a customer has already submitted an SSI or SSDI application or is receiving support or assistance from another entity, it's hard for us to kind of jump in and see what was submitted, where they're at in the application process, and advocate on behalf of the customer. So if they have a pending application, most likely we will deny that application because they're already receiving support and it's already in pending status, and we can't do anything until Social Security um, officially approves it or denies it. Um, and if it's denied, I just want to put it out there, and the customer has a denial notice, they could be re-referred into our program. Any questions so far about HDAP or the eligibility criteria? Okay, next slide, please. A brief overview on the care coordination and housing navigation. We assess and identify clients who are the highest priority for permanent supportive housing through the Coordinated Access System, CAS. From that pool of clients, they will screen who does not have yet disability benefits. They will refer potential eligible clients to the HDAP program via HMIS and connect HDAP clients to housing navigation and care coordination services. When housing or other eligible financial assistance is identified by SSF or the client, SSF will facilitate the completion of required documentation for requesting payments from DHA, and will elaborate on the housing component of the HDAP program a little later. Next slide, please. In regards to the duties of the DHA staff, how I mentioned, I have two amazing social workers. There's currently 40 slots available for the HDAP program. Some have already been filled, and we do have some open slots available that we're trying to fill. But our DHA social workers and myself will review the referrals to HDAP and enroll eligible prioritized clients into the HDAP program in HMIS subject to program capacity and prioritization. Will provide disability advocacy for HDAP enrolled clients. And that entails meeting the customer where they're at, explaining our program, and if found eligible, assist them with getting connected to Medi-Cal, um, obtaining medical records from doctors, assisting them with applying for SSI, SSDI, and from start to finish that application process, and to also advocate on their behalf. HSAP staff and care coordinators will work together on developing treatment history and evidence to support the disability application for HSAP enrollees. And then we'll also process requests for payments and issue payments as requested, or we'll reach out to the requester to address and correct any deficiencies in submissions. Next slide, please. In regards to the referral process, CAS assessors will assess and SSF will identify clients who are the highest priority for permanent supportive housing. From that pool of clients, they will screen who does not yet have disability benefits. Those identified will be referred to the HDAP program via HMIS. Assigned social workers will assess case eligibility and meet with the supervisor, which is myself, and the McGeorge School of Law representative on whether to open the case and move forward with the application process. The social worker will notify SSF of referral outcomes or their case manager if they're tied to any other program. Next slide, please. In regards to medical records, in order to move forward with an application, the client must have at least 3 to 6 months of verified medical records that indicate that the individual has a disability or the symptoms experienced due to the disability is significant enough that the client will not be able to participate in full-time paid work. This is very important only because we've seen some referrals where the customer is stating that they have certain medical diagnoses, but they have not seen a doctor in 16 years, 10 years, or 5 years. And without medical evidence, it's not a strong case. And so we may potentially deny the referral if there's no medical evidence of their diagnoses. But again, social workers will staff the case with the McGeorge School of Law representative to assess the medical records and determine if there is not enough evidence to support the case. Social workers will provide resources to the client to increase their care. And if client does not want to continue with medical care or is not consistent, the social worker will provide information on alternative legal support services with the process and exit the case as need be. Next slide, please. Our HDAP program consists of 4 major components, which are listed here. It's program outreach, case and care management, housing assistance, and disability benefits advocacy. And I'm going to elaborate a little bit more in greater detail on each of these different components. Next slide. In regards to program outreach, CAS assessors will engage in activities to identify, target resources, and or connect high priority customers or customers for permanent supportive housing to HDAP services. To educate community partners and potential eligible individuals, the HDAP program will be accepting referrals through the 211 line and process all referrals through the HMIS platform. And this is why we're doing today's presentation because, you'll most likely be getting calls regarding the HDAP program, and we just want to make sure you all are understanding of the program and the services that we provide. Next slide, please. Case and care management. SSF will connect customers to enhanced care management, and DHA staff will provide case management to each customer, starting at enrollment through every step of the disability benefits application process. Services will assist the customer in navigating and addressing barriers to treatment, including Medi-Cal, CalFresh, behavioral health providers, and medical providers. Following a housing first model, all services will be voluntary, and HDAP program staff will work to engage all participants in services. And because we are the Department of Human Assistance, we have connections in all the DHA offices where we could help the customer get set up with CalFresh, with Medi-Cal, and also selecting a care provider to get that treatment that they need. Next slide, please. Housing assistance. SSF will connect customers to enhanced care management services that will connect customers to potential housing opportunities. They will schedule housing plans with the customers, offer interim housing options, finalize document readiness with the customer, and upload those documents in HMIS. They'll visit units with the customer and assess move-in needs. Housing case managers will meet with the customer weekly to continue on their housing goals. The ECM will submit any financial assistance needed to create a stable living situation for customers to the DHA team to be processed and issued as needed. Next slide. The main goal of the program is the disability benefits advocacy part, and DHA staff will provide comprehensive disability advocacy for all customers. Our HDAP program staff will assist customers to apply for all disability benefits programs for which they are potentially eligible for with the Social Security Administration office. The McGeorge School of Law representative will provide review and advisory of medical records, provide legal representation at the reconsideration or hearing stage, if applicable, and support social workers in legal aspects of the disability application. And when I tell you our social workers are meeting the customers where they're at or inviting them to our DHA office, they explain all the program requirements and eligibility criteria, and they're helping them complete the application from start to finish. They are the authorized rep. They're reading letters, they're advocating on their behalf, and ensuring that they guide them through that long and tedious process. If any of you know how that is, it's very long. Next slide, please. We do have folks that we exit from our program, And so I want to talk a little bit about those exit reasons. First and foremost is participation. As mentioned earlier, this is a voluntary program. Participation is required from the customer. And if they're failing to participate in services, are not meeting with the social worker cannot reach them via phone, in person, or another case manager for over 30 days, we will exit them from the program. But I want to just state that we will always attempt to engage first and try to locate them before exiting them. The second reason is the customer has declined services, meaning they're declining to be part of the program. They're not attending medical appointments as scheduled, which would impact the SSI, SSDI application process, or they're denying recommendations that would help in the process of the appeals or hearings or approvals. And so if they're declining services, then the social worker will stop the case with me and we'll make the determination to exit the customer for declining services. The third reason is safety. So the customer's actions cause a safety concern to other participants in the HDAP program or our staff, and the customer has refused to address those safety issues, and DHA management has moved forward to closing the case due to safety concerns. The fourth reason is documentation, which is customer refused to provide or sign required documentation for program requirements, such as income verification or the SSA 1696 form or other SSI, SSDI required application forms that are needed, like the ROI and whatnot. And the fifth reason is the one we would like to see the most is the case is approved. So customer was approved for SSI or SSDI with our support, and they are now receiving their monthly benefit, which is verified as correct. If this is the case and their case has been approved, we've done our due diligence and we will do a program exit because we got them set up and everything is good to go. Any questions regarding the program exit reasons? Next slide, please. If a customer is not happy with the services that they're receiving from HDAP or have a complaint, they could file a grievance with our hearings department. And so they could write a statement and drop it off in the mail, or they could visit the local office, 420 North 3rd Street, or call the 1-800-952-5253 number within 90 days of the negative action. We also wanted to provide some legal services that are free in the community on the bottom left-hand corner. Next slide, please. And that's all that I have for today in regards to the HDAP program. But if you have any questions, you could reach out to me directly. I'll drop my email in the email box. We also have a general box, DBAP referrals at saccounty.gov. Any questions, comments, or concerns regarding the HDAP program?
There does not appear to be any questions in the chat just yet, but we still have time. Ricardo, thank you so much. Wonderful presentation, and now we'll turn it over to Leah.
Hi, everybody. I'm Leah Kingsley. I am one of the referral specialists here with SSF. And I'm here today just to explain kind of the SSF end of the referral process. So we'll get started. Next slide, please. Okay, so just kind of an overview of the HDAP referral process in regards to 211. So comparing the two processes. So when y'all receive a general call without an HDAP request, you may do a crisis assessment or an HCT for that client, and then obviously provide other resources as needed. However, when the client is requesting HDAP, you would receive the call. And then if they do not have an HCT, you would need to do that assessment for them to be eligible for the referral. And then you would email us with the client information. Then once we receive the email, we check our priority list and determine client eligibility. Next slide, please. Okay, so just an overview of the referral path for this program. So we are checking our priority list to screen clients for eligibility. So we're selecting the most vulnerable clients first, and then checking them for if they're eligible for HDAP. And then if the client is eligible, we send a referral interest letter via email to the program to the client's direct service provider who they're currently working with. Assuming that the client is interested in that opportunity, then they reply to the interest letter and they let us know, about the client's interest. And then if they are interested, we create the referral in HMIS. And then the next step would be we send a confirmation email to connect that service provider with the HDAP team so that an intake can be coordinated. Next slide, please. All right, and so how are we determining client eligibility for this program? So every day we're notified of program openings via HMIS. So we're looking at those program openings every morning, and then we're seeing if there are program openings for HDAP, we will review our priority list to find eligible clients, with the most vulnerable clients being considered first. And then we do additional screening when we're sending that referral interest letter to the client's case manager. So these are the 4 questions that are in the referral interest letter. The first question is if the client is experiencing chronic homelessness. The second is, do they have a mental or physical disability expected to last over 12 months and or be 65 years or older? The third question, do they have a pending or approved SSI or SSDI application? And then the fourth question, do they have an authorized representative or attorney assisting them with the SSI or SSDI process? So when we're screening and receiving responses back from those referral interest letters, we're checking to see if they meet that screening eligibility. So for the first 2 questions, those would be yes. And the second 2 questions, they would be no. And if their answers differ from that, we would assume that they're not eligible for the program, but we'll probably do some digging and communicating just to make sure. And so that's how we're screening for client eligibility. Next slide, please. Okay, and so just some details around the housing navigation part as it relates to SSF. So right now, we're not currently connecting clients to housing navigators. So 211 or a direct service provider could refer clients to CalAIM or other housing navigation services when y'all have capacity, just so that client is receiving those wraparound services. Eventually, the goal is for SSF to have that dual referral so that we're referring the client to CalAIM and to HDAP at the same time. But the process is still being worked out for us to do those direct referrals to CalAIM. So just something to be aware of that if that client does need those additional services, I would ask that either y'all or the direct service provider do that linkage. And then also the DHA social workers, they're welcome to complete the case conferencing tool in HMIS. So that way our referral specialists better understand the client's housing preferences, but that's not mandatory. Next slide, please. All right, and that's it for me. Do y'all have any unanswered questions about the referral process or HDAP program?
Hi, Leah. There is a question in the Q&A from Kaylee.
Yeah.
Since the goal of HDAP seems to be to get PSH eligible individuals connected to income, is there a warm handoff procedure to keep those who have been approved to other case management to support with PSH?
Mm. Okay, so are you asking if they have been approved for HDAP, are we handing them off to another case manager at that time?
And Kaylee, you are welcome to come off mute if you can.
Can you hear me?
Yeah.
Sure can.
Okay, perfect. I was struggling to come off mute. My question is because once someone's approved for SSI or SSDI, they get exited from HDAP, like that is the completion of the program. But now they have their income and maybe eligible for PSH, but now are no longer receiving case management. So that's my question is like there a transfer process there so that they can now get support with PSH now that they have all of the eligibility requirements theoretically for that.
Gotcha. Um, I guess, Ricardo, maybe you can also speak to this, but I think what I am thinking, or how I understand it, is that they would be connected to their case manager who they first were with when they received the referral, and that person would stay with them through the completion of the program. But correct me if I'm wrong, Ricardo.
Yeah, so typically most of the referrals that we've received and we've approved or enrolled into our program, they're already connected to a case manager through CityNet or, another entity in the community. And so they're still working with that case manager and working with our HDAP social workers until they are exited from our program. Now, I just want to be honest and transparent. If you know anything about the SSI, SSD application, it's very time consuming and it's lengthy. It could take up to a year or 2 years. So we are constantly working with the customer for that duration of the time, as long as funding for the program still exists. But yeah, we're seeing that our social workers are communicating with their other ICMS case manager, and we're working together to support them with those wraparound services that they need. Does that kind of help answer the question?
And I'm realizing we didn't specifically say this before, but at this time, we're not referring clients who do not have a current case manager. So that way they are able to continue receiving those wraparound services.
Thank you.
Yeah, and on some occasions, that case manager, they're the ones that help us connect with the customer because, information has been outdated in HMIS, but when we see they're already connected to another provider, it's easy for our social workers to reach that customer through them, or we'll tag team and go together to do like a visit at a shelter or wherever they were last located at.
Thank you. The next question that we have is from, I think it's Rachel. If they have an older HCT, is there a time frame of when a new one should be completed?
I believe it's every year. Correct me if I'm wrong, Jody, you might know this answer as well. And sorry, it's the HCT is still kind of new. But also if something changes that would impact their score, I would recommend doing a new HCT at that time as well.
I'm going to add to that simply because I was just editing our training slides yesterday for our intro to HMIS, which is part of our CAS Assessor series. So you can learn all the specifics about each of the assessments, including HCT, and I believe that's coming up second Tuesday of May. you'll get all the details in there about frequency. You can also find on our website a CAS assessor best practices guide, which will break down questions just like this. And I will hunt around and find it for you and drop it in the chat. While I'm doing that, Leah, are you able to respond here? Molly asked if you could please remind everyone what the definition of chronic homelessness is, according to HUD. And I'll be right back.
Gotcha. Okay, so chronic homelessness, it means that an individual has been homeless for 12 months. So there are two different ways that this can be done. So the first way would be they've been experiencing homelessness consecutively for the past 12 months, or they've been experiencing a total of 12 months of homelessness in 4 separate episodes within the past 3 years. So either way, it's that they need to have the total of 12 months of homelessness to be considered chronic homeless, and then also that they need to have a ongoing disability. And yes, that's the HUD definition that we're using.
Thank you so much. At this moment, there doesn't seem to be any more questions in the chat or our Q&A box. I did add the best practices guide for CAS assessors, or really anyone working with any of the assessments, in our chat. And with that, I will remind everybody that you will receive a copy of the slides if you do choose, and as well as a recording of this content. And I'll stick around for a couple more minutes for any other questions. All right, just to be clear, Rachel, you are welcome to come off mute if you'd like. Just to be clear, we're able to complete HCT for clients who are not just chronically homeless, but at risk also. I don't know if you can see me shaking my head. That's a solid yes. Yeah, my awareness is that the HCT opens up opportunity for additional wraparound services. Leah, would you say that's accurate as well?
Yes. And also there recently were questions that were added to the HCT to screen for at-risk clients specifically, because we're having more and more programs that are coming online that are looking for those at-risk clients. So you'll notice that there are some additional questions for those clients now.
Excellent. I didn't know that there's any questions. That's fantastic. I
Yeah.
will also, I'll also plug, because it's my job to remind everyone about our upcoming trainings. June is already full for our housing problem solving training. For any 211 staff who has not completed that, it is highly recommended. We have another training in September as well as November. And those trainings really get into prevention and diversion practices. We are looking forward to 2026 offering that 6 times a year instead of 4, so folks can repeat it as needed, because each time we have a new group of folks, which means new stories, new challenges, and new connections and celebrations as well. Yeah. So thank you, everybody. I appreciate your time being here. Molly, thank you for rallying your team at 211 and advocating for this training. Ricardo, again, thank you. It was wonderful. Ricardo will be presenting this at our Frontline Collaborative in July. I did see your email. Thank you for that. And if you are not aware of our Frontline Collaborative meeting, Frontline Learning Collaborative, it happens the 4th Thursday of every month. And you can find more information on our website, on the CAS website. Thanks, Leah. I appreciate your time and expertise. And I will give everybody back 20 minutes. Yay.
Everyone.
Bye, y'all. Thank you.
Bye-bye.